You may have clicked on this video because you're right now experiencing unwanted, violent, intrusive types of thoughts. Now, when those thoughts are around the harm of others or even harm to self, they can be very disturbing. So there's a few things that I want to talk about right away. If you are feeling that you want to harm yourself, you have a plan and you have intent, I would ask you to please call 988. It is the National Suicide Hotline. What we're going to go through today is something that we call harm or violence-based OCD. My name is Dr. Patrick McGrath. I'm a licensed clinical psychologist and the Chief Clinical Officer at NOCD. Today's video is not meant to diagnose or to treat anyone, but to give information around what harm OCD might be like. You might think, wait a minute, there's not an OCD like that, but there is. It's a very common type of OCD. Actually, OCD isn't just washing your hands or checking for germs. It can involve harm as well, too. It's not uncommon at all for any of us who, say, get cut off in traffic or somebody yells at us to think, well, oh, I oughta, or something of that nature, but that's a fleeting thought for almost everybody, and it just kind of goes away. For some people, though, it doesn't end there, and they start to worry about, why did I have that thought? And what if I were to go through and actually follow through on that? And what if I really wanted to do that? And it can get to a point where those thoughts take hours and hours of your day, and you don't know what to do to stop them. And the more you try to stop them, the worse they seem to get. If this sounds like you and something that you're experiencing, please continue to watch this video. What we'll do today is walk you through how you recognize what OCD is, what's the cycle that it follows. I'm also going to show you some things that you can potentially do right away to help yourself get through this experience. And at the end, give you some links so that you can reach out to people who might be able to help you if this sounds like something that's occurring in your life. Let's talk for a moment about what the cycle of violent and harm OCD really looks like. Anyone can experience, as we said earlier, a trigger. Again, it could be something as simple as somebody yelling at us, and that could lead us to have some kind of an obsession. Now, what is an obsession? An obsession is an intrusive thought or image or urge that we experience, and it creates feelings that we don't like. Guilt, disgust, distress, anxiety. We may find these obsessions inappropriate, and we want to do something as quickly as possible to neutralize them. There are people who have this type of OCD who are afraid when driving that instead of hitting a pothole or a speed bump, they ran someone over. And so when that happens, instantly that brings about a compulsion. They want to drive around the block to see, oh my gosh, where's the person that I hit? I need to help them. I need to save them. So they do that. They drive around the block and they look, but they don't see anybody at all. And then they think for a moment, okay, maybe I didn't actually hurt anyone. So they drive off, but they get about 10 or 20 feet and they think, nope, I don't know that I checked well enough. I'm just going to go back again. And they go back around the block again. And there's people who do this 30, 50, 100 times. And a compulsion is a mental act. Maybe we say a prayer as a way to undo whatever it was that popped into our head, or it could be an actual behavioral thing that we do as well. And that could be something along the lines of, I'm going to make sure when I walk past people, I put my hands in my pockets so that they're there and I have no chance of accidentally even swinging my arm and punching somebody. See, OCD is insatiable. You can never do enough compulsions for it to truly be satisfied. If what I've described sounds like something you've experienced or is similar to something you've experienced, this video will help guide you through the experiences that you've had, but get you to break free of it without doing a compulsion. Any way that this happens, when we do these compulsions, we feel some relief, but it lasts just for a little bit and then the cycle goes again, and it's the hamster wheel and we're going around and around and around and around, and boy, do we want to get off. And OCD says, well, there's a way off. Just do the compulsions and everything will be fine. But then you'll just have to do them again and again. So what do we do? The treatment that we would utilize for people who have violence or harm-based OCD would be something we call exposure and response prevention therapy, or ERP. It really involves two things. First, purposely being exposed to whatever that thought is. That's the obsession/exposure piece of the work we do. And then not doing the compulsion. And that's the response prevention piece of the work that we do. Let's talk about an example about how we might treat harm-based OCD. Right now, you may be having so many doubts and insecurities. You may be worried, what if I were to harm myself, or what if I were to harm someone else? I want you to continue to be there, in that feeling of doubt, in that feeling of insecurity. And I want you to allow it just to sit. Now, it isn't surprising if you actually notice it start to feel worse. That's typically what happens at first. That's your OCD screaming at you saying, you must now have an answer. I want you to start thinking, I'm noticing something that I've never allowed myself to experience before. I can handle it. I may not like it, it may not be comfortable, but I can handle it. That's the key in this entire experience. If we allow that just to be there, just to stay, over a little bit of time, you'll notice it hits a peak, and then it's going to start to eventually come down. Now, I know that sounds uncomfortable, and it is a bit when we're doing this, but there's a goal behind that discomfort, which is to learn that I can handle it. I don't have to listen to what OCD tells me to do. I can live the life I want to live and not the life that OCD wants me to live. If what I've described today sounds like something that's going on in your life, there is help available. Feel free to interview therapists to find out if they truly know how to treat obsessive-compulsive disorder. Ask them questions like, do you utilize ERP for the treatment of OCD? And how many cases of OCD or anxiety disorders have you treated in your career? If they're not using ERP, I would consider reaching out to other people to see if they might utilize ERP instead. Now, there are several ways that you can find a qualified therapist who helps with obsessive-compulsive disorder. The International OCD Foundation directory is excellent, and you could reach out to NOCD as well. At NOCD, they'll offer you live face-to-face therapy sessions that occur online, and you can use your insurance, very likely, to pay for those sessions as well. You can get connected with licensed OCD therapists right away by downloading the NOCD app or going right to the NOCD website, and you can book a free 15-minute call with the team. You'll start doing live face-to-face sessions with your therapist, and then between sessions, you'll be able to message your therapist or even participate in peer-led support groups. There's also great therapy tools on there available for you as well to use between sessions. We'll include a link in the description below, as well as resources from Healthline to help you with your intrusive thoughts around harm OCD. Thanks for listening, and remember, you're not alone. Help is available.